This is the Mohsin Mortgage Program with Sarah Mohsin. Mohsin Mortgage is licensed in several states for residential and commercial purchases and refinancing. Call 800-662-9550. And now, here's your host, Sarah Mohsin.
Great to be back here again, folks. And it is the Pittsburgh Weekend Edition. Hashtag the Mohsin Program. Feel free to reach out to us, 1-800-662-9550. Every month we have a nonprofit on, and it's valuable to us. It's empowering. It provides education. And this weekend, special shout out to Alan Levine for his recovery. I know he just went through surgery with his kidney transplant. And so we're really celebrating with having the National Kidney Foundation here. We have both Jenny and Aaron from the foundation. How are you?
Great.
Wonderful.
Thank you for having us.
Oh, no, it's a real
Sarah.
pleasure. It's an honor because life-changing work. And there's certain areas that a lot of areas people don't know. I was doing my reading. And so I'm going to just give you the time to just share. Okay? Yeah. So tell me a little bit about the National Kidney Foundation.
Yeah, we are the leading organization in the United States for the awareness, prevention, and treatment of kidney disease. We work on many levels. We work with patients, families, healthcare providers. We also work at the government level. We do advocacy work to change public policy. We offer a number of programs and services within our local communities. We have 26 offices across the country. We're a national organization.
And we're here in Pittsburgh. And a lot of viewers and listeners, I'm sure, maybe don't know that we're here in Pittsburgh. And like Jenny said, we are a national health organization, the national health organization dedicated to the awareness, prevention, and treatment of kidney disease. And we're one of 26 offices across the country on the front lines, ensuring better outcomes for the 37 million Americans who are affected and impacted by this disease. Nationally, we have 225 dedicated staff members on the front lines, like I said, working very hard to serve the needs of the community. If anybody is interested, like I said, we are in Pittsburgh. We're right on the south side, near the Cheesecake Factory, and we love to have people come and visit us. So you can always check out our website at kidney.org as well.
Perfect. So when you raise funds, where does the money go?
So, so where does the money go? We, like I said, we do lots of events and programming, and they can't be done without each other. Sure. And so 82 cents of every dollar that we raise at our events, and we can touch base on what those events are locally, directly go to our programs, our education, and our research initiatives. And by that's a very high number of cents to go back
very
into
much
the community.
So, actually. I'm very surprised.
Yes. And we pride ourselves on that, not just from a national level, but also from a local level. And knowing this, allows us to stay focused on fighting for public health and advocating, as Jenny touched on, for all of kidney patients. Some of the programs that we do in the community from the funds raised are our NKF Cares Patient Helpline and our NKF Peers Mentoring Program. Also, we give away grants to fellows that want to go into the nephrology world and study. They're called Young Investigator Grants and much more. And here in Pittsburgh is unique because we're blessed to have a great partnership with the state of Pennsylvania to be able to offer a state-funded transportation program that assists patients with their transportation costs associated with traveling daily, weekly to clinics for dialysis. So that is very unique here in Pittsburgh.
Very good. How many people are affected? About 37 million?
37 million Americans. So that's roughly 1 in 7 adults. Nationally.
Many don't even know that they have it yet.
You were saying, we talked earlier. And the cost for testing is very cheap, isn't it?
It's very cheap to get the test at your PCP, but it ends up costing our government $41 billion a year to support kidney patients nationally. Wow. So the average dialysis patient, it costs,
80. It changes.
It changes it goes up every year.
$86,000 per patient.
A year.
A year is what we're looking at.
Right. And to get tested, is it, did you say $8 or something?
Yeah, it's about an $8 urine test for one of the tests. And really, we're trying to educate PCPs to do these tests so that we could catch it earlier, because what we're finding is people literally crash into dialysis. They just feel like they have a cold, they feel run down, and then before they know it, they're in the doctor and they're being told they're in a stage of kidney disease and they're being put on dialysis. When there were preventative measures they could have taken, you know, well in advance that would have helped them, you know, so much. So really, we do a lot of education with our medical personnel also.
Awareness is key.
Yes.
Awareness
It
is,
is.
and that's a pillar of our mission, awareness, prevention, treatment. And as Jenny was talking about the tests, you know, especially if you have a risk factor, and I know we haven't touched on the risk factor, but the risk factors are high blood pressure, diabetes, and a family history of either. So mother, father, brother, sister, they have it. You should be asking, and it's getting that message out that if you have those risk factors, you know, oftentimes PCPs and your doctor, they will not, they just, unless you need to be your own health advocate.
Yes.
And that's what is important, whatever disease you may suffer from. And that is our key message is to be your own advocate and to know, okay, if I have one of these risk factors, when I go for my annual appointment, check me. Can I have the urine test, which again is so cheap. It's so cheap. And basically what that urine test will tell us is it estimates the amount of type of protein, which is albumin, that you excrete in your urine. And protein, you do not want to spill protein. So that is, if they find it, that's one key component to identifying, and then obviously
They'll look at your age and your family history also.
Right. And then there's ethnic, right?
Yes.
Based on being Asian or...
So minority populations, yes, they have high rates of diabetes or high blood pressure, and such as African Americans, Hispanics, Asians, Pacific Islanders, and also Native Americans. And so knowing that this disease runs rampant in those ethnicities, that in itself also is important to know and to ask. And you know.
We do a Keep Healthy screening. That's one of the services we provide to our local community that we use the money we raise to put those on, and we try to do them in underserved areas or places where we know that our, you know, people are hit hard by this disease.
It's important. I think education's important, getting the facts. You know, we live in fear, or we don't want to deal with it, but getting just a quick checkup to find out. And it's inexpensive, and it can create prevention versus all of these other issues that we face, you know. And
we're trying to turn from, you know, kidney disease to kidney health.
Yes.
That is like our CEO of the NKF, he's a kidney patient, a transplant recipient, and he's working very hard to trickle that message down so that we could make that transformation from disease to health.
So can you just give your website again?
Yeah, well, our national website is nkf.
Is kidney.org.
Kidney.org,
Yeah,
but
www.
our
local website is kidneyall.org.
and you can find like all of our local events and ways to get involved, ways to volunteer.
Right. You have 4 events that come up, right, through the
Yeah.
year. Can you mention some of there are 4?
Yeah. We just finished Monopoly, our corporate Monopoly tournament, and that was at
Fun.
Rivers Casino.
I love Monopoly.
It is
I
such a
missed
fun
it.
event. This is a win for everybody because even if
Wow.
you don't have a connection to the disease, you get to come out, you get to be a part of a 4-person team, you network with all kinds of business leaders.
I love Monopoly, though. I'm obsessed with it.
Oh, it's
Play
so
for
fun.
90
It's a blast from the past. We have bankers. They wear the visors, and
Cool.
it's just really fun. So, you know, you give back to a great charity. You learn more about kidney disease, but you also have a chance to network and just have a fun night. And then we have our upcoming walk, our kidney walk.
Yes.
It's at the Pittsburgh Zoo on November 3rd. And it's really a day of celebration. We have, you know, people who have had transplants, people who are in a stage of kidney disease who are looking for a living donor. We have many walkers from dialysis units, from medical centers. It's just a great day. We attract about 2,500 people. We have a lot of great entertainment for kids, face painters, and princesses, and it's really a leisurely walk through the zoo. So, and it's just, everyone wears a themed t-shirt, and it's a great day.
I've heard, and I have friends of mine who are part of that walk, and I'm a big believer, if you can't make it, you can volunteer or even donate, right?
Yes. Yep.
Yes, we
People are
definitely
raising
volunteers.
funds through their teams right now. We can gladly take a phone donation or a mail donation. You can be a virtual walker. It's a great way to get the word out. When you form a team, we have all kinds of messaging systems that people can send out to their friends and family. You can post through Facebook, and even if someone donates $5, they're impacting our mission, and they're learning about the disease.
It's very important. I believe that everybody is exceptional because we have that ability to make an impact on each other. It's just one small thing. It doesn't have to be, money. It could be volunteering time, because the person who volunteers gets to learn a great deal. I think that that's a great way. But it's also providing support, because we're a very close-knit community. And Pittsburgh has been, very, I think, to me, one of the best places I've lived in as a city.
Yes.
And people do come together, and they do care, and they believe in sharing, making sure we're investing in each other. And no average people out there. They're all exceptional, each and every one.
We couldn't do what we do without our volunteers. They're amazing. And I always say, the gift of time is the ultimate gift, because it's very valuable in our culture. So, our volunteers are amazing. In Monopoly, we had volunteers get there early to help us set up, and stayed all the way through the event, through the scoring, and they were just willing to jump in any way possible. So
terrific.
Yeah.
Go ahead.
So for the walk, let's say you're looking to make a donation. You take cash, I'm sure.
Yep.
You take a donation online. Where would you go if you were to do a donation online or do the virtual walk?
Yeah, so you can go to kidneywalk.org and then just search by your Pittsburgh zip code, and it will take you right to our walk page, and you can do an online payment right then and there. You can also mail in a check to our offices and let us know you want to designate it to our walk.
Sure.
And you're always welcome to come to our offices. And
I like that.
Stop by. Yeah.
That's good.
Yeah.
It's important, just to know about the nonprofit, to know the work that you guys are doing. And I really like the fact that 82 cents goes towards it.
82 cents. And this Sunday, I'm going to mention this Sunday, we will be at the Square Cafe in Regent Square. We're doing a kidney walk brunch, get to know the NKF type of little event the entire day. We will be there
7 to 3.
7 to 3. I think that's their business
Their
hours.
business
are
hours.
7 to 3. And we'll be signing up people to attend the walk. We'll be taking donations. We will, as people are, having breakfast with their families, we'll have maybe some little giveaways, and it's just an open house.
We're going to have some mission moment speakers.
Yeah.
We have some people who are directly affected by kidney disease who are going to speak. And the restaurant's fabulous. The food is amazing.
It is so good.
And a portion of the proceeds will benefit our walk. So
Best day.
yeah, and all you have to do is eat a meal and come hang
That
out
works for me.
an hour.
So it's this Sunday.
That's great. And then what are the other two events that are coming up for the year? Is there one more or two?
So after our walk, we will be gearing up for our Kidney Gift of Life Gala, which is a really fun event. And actually, it's the Kidney Gift of Life Honors event. We've rebranded a little bit, but it is a gala type style event. And we kick off at Heinz Field and during the National Kidney Month, which is March. So March 7th, 2020 will be our gala. And what we do there, it's a unique event in that we honor 4 amazing, remarkable people who have touched our mission in some way or another. We have a humanitarian awardee, a medical awardee, we have a legacy of leadership awardee, and also a volunteer awardee. So it's a celebration of life. Actually, all of our events are celebration of lives. And we have about our attendance has been between 400 to 500 people each year, and we raise roughly just at gala about $250,000. Our walk, we are striving to hit our $281,000 goal, and that's just at walk.
And this year's theme for the gala is going to be the Roaring 20s in 2020.
Oh, very
kind
nice.
of a Gatsby theme, Prohibition. It's going to be really, really fun. So.
And then after Gala, we are kicking off the summer months with our Golf Classic, our NKF Konica Minolta. They're a national sponsor of ours. We're so thankful to have them. So it's NKF Konica Minolta Golf Classic, and that is at the luxurious Nemacolin Woodlands, June 5th. The night before, we have a post or pre-reception to invite our golfers. And we had 50 foursomes last year, so we were really excited. And it was our biggest golf tournament to date. We raised about $170,000 at golf last year. And
terrific.
Yeah, it was.
There's big numbers. That's great.
It was, yeah. And so that will be June 5th at Nemacolin. And all of these events you can find on our website at kidneyall.org.
It's interesting because the last year, I've never really actually been a part of the Kidney Foundation until I have two friends, and they reached out to me, and I said, wow, this is something that we really need to share more information on, because we really truly believe that the more knowledge you have, at least then we don't have to be fearful. Like, we're fearful about a lot of stuff, when it comes to health or finance or things like that. But if we just ask often enough, we can get that education and protect ourselves, at least with even diet and exercise and things like that, right?
Well, and a lot of people, too, part of our mission outside of just awareness, prevention, and treatment of kidney health is also organ donation. We are huge. That is encompassing in our mission. We increase the availability of all organs, so not just kidneys, for transplantation. And one of our programs, our newest program, is called the Big Ask, Big Give. And that's a program that we go out into the community, and we work to partner with transplant centers, so all of our major hospitals, and we teach people through a 4-hour workshop, so people, meaning kidney patients and their caregivers, how to ask for people to donate, to get tested, to donate.
And to feel comfortable asking.
To share their story.
Yes.
And get their story out there so that we can increase their potential of coming off of the wait list.
People are so afraid to ask their friends and family.
Sure, they are.
Hence, big ass.
It is a big ask.
Yeah, but we have two kidneys. We have two kidneys, and you can live a very, very healthy life with one kidney.
Yes.
The testing is rigorous, so the people who give a kidney are the healthiest people out there. They go on to live normal lives, and they saved somebody's life. So it's truly amazing.
Well, Alan is a dear friend, and he's recovering. He just had his surgery, and his son actually donated. His son served our country. So in all of it, it's very, emotional, but, it's wonderful because of the fact that we each have a gift that we can share, whichever way it is, whether it's organ donation or just showing up, supporting a cause. And the work that both of you are doing, it's really remarkable, because I'm sure it can be tough sometimes, right?
There are family, volunteers, people, patients, family members that just call us when they find out that they are just diagnosed. We always like to say, obviously when you get that diagnosis, you're taken back. And then obviously you talk to your family members, your caregivers, but we always say that we want the NKF to be your second call.
Yeah,
because
we drop everything to return your call.
Because of the resources,
to have a conversation with you.
So, and our website is there. It's overwhelming, and there's a multitude of resources on there. And like I said earlier, the helplines that we do have and offer 24/7, the NKF Peers and NKF Cares lines.
You can find out about clinical trials. You can pretty much click on any stage you are in, whether you're post-transplant, whether you're in a stage of kidney disease, and you can get recipes, tips, ways to stay healthier. You could even, put in certain meals from restaurants and find out if it aligns well with what you should be eating. Our website's wonderful.
Yeah, that's the app. We do have an app. It's called
you can
My Food
download
Coach.
right to your smartphone.
Oh, great.
Yeah.
And folks, I mean, if anything, if you miss any of it, we're going to have it on our YouTube station, #the Mohsin Program. And I just think it's really powerful, the work that you both are doing and what the Kidney Foundation is doing, because awareness is number one, and prevention. I mean, prevention is critical, and some of the little things that you can do to tweak, whether it's your nutrition or just being aware and getting tested, so you're not at that point where you have to be in surgery, right?
Yeah.
And locally too, we're always looking for people to join our board, our leadership board. Each of our offices across the country have, local leadership professionals who help. They're our backbone. We couldn't do what we do without our board members. So we have 14 dedicated members, long-term board members with us, and we're on a flexible, always looking for new leaders to join us in the fight. So.
Some have kidney connections. Some just were moved by our mission, but they give of their time. They help us, to connect with, different people in our community who we may not have a relationship with yet. And it's amazing. We also work at a government level. We do a lot of advocacy work. And just going back to that whole living donor, the fact that we need to increase, organs from living donors. Right now, we have the Living Donor Protection Act in Pennsylvania, and we're working to, have different government officials co-sponsor that. And Representative Mike Doyle just co-sponsored it. So
Terrific.
We're gaining traction in the government, and, if we hit it from all angles, community, government, we can make forward progress. So, yeah.
Right. And the more information that we share, the more visible it becomes, because of the fact that I didn't have as much knowledge until now about what it covers. Being a part of not only the foundation, but what you guys offer. The support system is amazing.
Yes.
It's not just doing events. It's being able to call in, have the help that you need, because sometimes you're with family, but sometimes there are times where you don't want to tell your family how you're feeling or the situation you're in, so you would rather talk to someone on the helpline.
Well, and that's a great reason why the mentoring program is so wonderful, because the NKF pairs you up with someone in a similar situation as you, because there's various stages or situations a patient could be in, and you could be a college student and just find out that you have stage 2 kidney disease, and you're going to a dialysis center and you're the youngest person in there, and NKF can pair you up with someone who's gone through that similar situation. And I think it's different than talking to your family.
Sure, it is. Just sometimes you need to just not have to just tell your family. You need to be able to talk to someone who may be more from the medical side of it or more from the counseling side of it. And there's different programs. There's also the spousal exchange for organ donation, I believe. There's different types of scenarios.
We offer a lot of support for families and caregivers too, which is really
and what
wonderful.
Jenny was talking, you were talking about our NKF peers. That's our mentoring program.
Terrific.
And the CARES is the helpline.
So we have 1 minute, ladies. And I'm really grateful that you both are here, because it's very informative and it's helpful. And did you have anything to add?
Erin recruited me for this job, and I remember sitting down with her and her telling me that kidney diseases, it kills more people every year than breast cancer, prostate cancer, or leukemia. And right then and there, I wanted to sign up for this gig, because people need to know that. People need to know that this is prevalent, and we have to get the word out.
And Erin?
Yeah, you know what? I've been with the organization 12 years, so I have a long history, and I couldn't be prouder to be part of the National Kidney Foundation, just seeing where we've come in the 12-year span, even though we're a 60-plus-year-old organization. And so I feel very blessed to be given the opportunity to share this mission of ours.
Well, I feel very grateful to have both of you here, because it's meaningful work that you both are doing, the Kidney Foundation is doing. And I mentioned, Erin, when we spoke privately, that I'd love to have you guys back on before the next event.
We'd love that.
Yeah.
Thank you.
And with that, folks, stay well.
This has been the Mohsin Mortgage Program with Sarah Mohsin. Mohsin Mortgage is licensed in several states for residential and commercial purchases and refinancing. Call 800-662-9550.